My name is David Hartley. I am the Director of the Insurance and Liability Resource Center for Nonprofits, and I've had that role for 5 years, so I work for a charity and also do consultant work, but entirely with nonprofits and charities across the country. I've had the privilege of being in nearly 70 Canadian cities and working with nearly 9,000 nonprofit leaders across the country in small towns, medium-sized towns, big towns. My passion is to work with small and medium-sized nonprofits and charities. So I love working with organizations which have very few staff, very few volunteers, or a combination of lots of staff, few volunteers, or lots of volunteers, few staff. And I've worked with quite a few immigrant-serving agencies as well across the country, including the host program here, Catholic Immigration here in Ontario. And I really appreciate what you do to help new immigrants when they come to the country and all the great work you do. Okay, so this is the first of 5 webinars we're going to be doing in the areas of risk management or healthy organization management. That's the way I like to prefer to term it. And each of the webinars will begin at 10:30 a.m. Eastern Standard Time and go to 11:30 approximately, and then we'll leave the last half hour for question and answers. For this first webinar, this is a re-record of the webinar, and so the questions that will be answered were done during the live webinar, and I'll be sending out a Q&A sheet for those questions that we do receive. Just a reminder that for all the webinars, your microphones are muted, and there's no way for us to hear you. We can never hear you. So you have to remember to always type your questions or comments during the presentation in the question box, and at the end of the webinar, they'll be handed to me. And that last half an hour for Q&A, I'll simply be going through questions that have been typed in or comments that have been typed in the comments box. So great privilege to be here today, and I want to say thank you to Ontario Children Foundation and Citizenship and Immigration Canada for their funding of this work. So it is risk management, but I'm going to try to make sure that we have a lot of fun doing these 5 webinars, and I'll do my best to do that. So risk management done poorly. I love this little sign. This is a sign hanging up, warning, children left unattended will be sold to the circus. Well, there's an example of risk management done poorly. And I just kind of juice you up at the beginning of this webinar and tell you you're probably going to have some fun here. But I love this picture. Did you smile today? I took the subway in today, and it's amazing how you find one person in 100 that's got a smile on their face and how that can give you a boost to your day. So I hope someone smiled your way today. Kids have an amazing ability to make you smile and to really take care of stress too. These are 2 kids, not 1, just in case you're wondering. I love this kid. Just fell asleep in daycare, real tired. And I think there's a lot of adults. Maybe you're on the phone today or watching this webinar and you're feeling tired too. Amazing. This kid is not unhappy. Had markers drawn all over his or her face, and I think it's a girl, and she's not unhappy. She's fine. Kids have thick skin a lot of times. It's quite amazing. Well, my 3 goals with these 5 OCASI webinars. Number 1, help you find practical ways to find and manage your key risks. So it's so critical that you know, and I suggest a plan I'm going to give you in this webinar to do every 2 years so that you really know what your key risks or critical risks are and then figure out ways to manage them. Number 2, help you engage your people so that policies and tools actually work. It's absolutely the truth that if you just go Google and find policies and put them in place, a lot of times they're not going to work. First of all, they don't have the wisdom of your people who do the work in your programs. And number 2, because they weren't involved in it, people often don't buy into it. No matter what training you provide, it's very difficult to get people turned on to policies that they had nothing to do with creating. That's why I tell board members never to write operational risk management unless they actually are involved in the day-to-day operations, which they shouldn't be unless they're a very small startup nonprofit. Number 3, I'm going to try and make this engaging and fun for you as much as I can. All right, so just to start off, I want to give you kind of an overview of kind of the key risks that you'd see when you look at nonprofits. Well, there's financial risks, number 1. There's actual alleged mistreatment of vulnerable client. There's accidents. There's driving situations. There's over 1 million accidents in Canada every year, so it's very important that any driving that's being done by volunteers or staff member on your behalf, that we consider the risks that are there. Food poisoning, also you could add alcohol to this as well. anytime you have potlucks or food being served, and anytime you're involved in serving alcohol, or even just putting together something where a hotel or some other organization is serving the alcohol, alcohol is a really critical risk. And we're not going to get into that today, but I just want to point out that if you do serve alcohol, or you are at a hotel where it's being served for an event that you're doing, or a fundraiser, or anything of that degree, you need to take extra special precaution. One of the things I recommend to organizations is give wristbands to everybody who attends, and the bartender can punch a hole in the wristband, let's say 1 drink per hour or 3 drinks for the whole night, whatever you decide, but a wristband that cannot be taken off. And don't use tickets, because they just can be passed around. It's a bad idea. Better still, just stay away from alcohol altogether, no matter what you're doing. Staff event, volunteer appreciation, birthday parties, just stay away from it, even at a local restaurant. If it's an event that you're paying for, or agreeing to do, or telling everybody to come for a team meeting, just make sure that alcohol is not part of it. It's my suggestion. There's too many problems out there. Number 6, internet technology related issues. That's everything from Facebook to what's on your website. Workplace violence and harassment, that Bill 168 in Ontario, which passed a year and a half ago. If you don't have workplace violence and harassment policies up, and you have 5 staff or more, then technically you're breaking the law. So just Google Bill 168 Ontario. You'll find a document that the government's created, and you can, I believe it's a 50-page document, and in the appendix you can actually see the wording of a workplace violence policy and a workplace harassment policy. That will be excellent for you to use. Number 8, natural disasters, severe weather. Number 9, key staff loss. That's, loss due to death, loss due to retirement, loss due to leaving for another organization, other ways. But a key staff loss has to be seen. You have to prepare for that. You have to prepare for illness. Someone's away for a few months. For the key staff, how are we going to do that? And the pandemic helped us with H1N1 and other pandemics. We've had nonprofits that before never kind of went through the process of thinking, okay, who's going to do payroll if our payroll person's sick? Who's going to X, Y, Z? So getting some sort of process in place. And fraud, embezzlement, theft of data or money, if you keep lists of funders or any sort of list, that you keep them locked up, that's also staff and volunteer files. Very important that we keep them locked up. There's an example of some risk areas that you can think of. I'm going to give you some more information, but that's just a starter piece. Here I have the number 9 in red, key staff loss. I want to point out something that I'm trying to talk about. Again, my name's David Hartley, and my email is davidandrewhartley@gmail.com, davidandrewhartley@gmail.com. One of the things that I'm doing, no matter what I'm doing, governance training, leadership training, risk training, insurance training, is to stop for a moment and try to focus on this issue that I see as a critical risk across the country and all the territories and all the provinces. No matter what the organization is, nonprofit, social service, working with new immigrants, sports organizations, churches, you find key staff really stressed out and in some cases burnt out. So I just want to make a point at a risk webinar to point out that this is a key risk and it's often overlooked. Here's an example of a Newsweek article where they found a Harvard president just exhausted and collapsed on the floor. Oftentimes it's, people recognize people are really stressed, but they don't do anything about it. It's so critical. Before you know it, the stress just can overload you, just like this pile of wood on this car is doing to this vehicle. And a lot of people start to feel like that. Feel like the donkey here that's being overloaded. And oftentimes, what do we do with our best people? We give them more work to do because they're so good at it. And it really is a problem in the nonprofit sector. We jokingly say that sometimes the nonprofit sector can't offer you more money, but we can offer you a better title and more responsibilities. This is from Dr. Richard Swenson. He wrote an amazing book called Margin, M-A-R-G-I-N. The idea is a piece of paper has space all around the outside. We call that margin. That in our century now, many leaders they wake up tired and they go to sleep tired. Their fatigue just builds and builds. Look at this graph here. On the left-hand side, you have productivity. On the bottom, you have stress. So at the beginning, stress actually drives productivity. Stress is not a bad thing in itself. We need it. I know one study, they They offered people the opportunity to get paid the same amount of money they do at their job. All they had to do from 9 to 5 was go and sit in a room and not do anything. You know, the food would be brought to them, they could go to the washroom, but that was it. And, you know, after a while, nobody survived that. They would rather work a job twice the stress level of the job they have than to do nothing, because it's just actually horrible to have nothing to do. And you can see stress drives many of us, deadlines, etc. It helps us to be very productive. But you see at point A, at a certain point when the stress is building and building and building, at a certain point productivity starts to turn around. That's the point here. At point A, the fatigue sets in. And all of us have felt that. This is not unusual to have moments or periods of fatigue. Think of it as 80, 100, 120. 80%, you know, is it the time of life right now where you or maybe some of your key leaders are at 80% of their maximum abilities in terms of before they start getting physically exhausted, emotionally exhausted? 80% is fine. That's great. 100%, so you're at your maximum. You can do that for a while, but you know you have to find ways to get back. 120%, well, a lot of people live, they're beyond their reserves. There's no reserves. They're beyond their maximum. And you can do that again for a day or two, but eventually you will, it will get it, you know, hit you. So in this situation, this graph, here's my point. Ask your key team leaders, your key people, are they before A, which is great? Are they at point A? Are they at point B where exhaustion is starting to kick in? Or are they at point C? You know, starting going from stress, which is okay on its own, to fatigue, stress that's causing fatigue and productivity is dropping, into exhaustion and burnout where productivity can go right down to zero. And so we have to be kind of keep an eye on our key staff. Board members need to keep an eye on their executive directors to see, are they overloaded? It's a critical risk, and I just want to point out a couple little points on that. You can't manage time. You can only manage your life. It's important to know. Our webinar is going to be exactly an hour. The time's going to pass no matter what I do. High quality life has more to do with what you remove than what you add. Steve Jobs, who you know passed away, he ran the Apple. He, you know, one of the most successful leaders of our last century. And one of the things that he said was efficiency is saying no to more things, not saying yes. And so it's so critical when you look at leaders who really, really do their job extremely well. They know what things to say yes to, what things to say no to. I'm suggesting today that have a sheet of paper next to you, and I suggest that you do it for any training you go to. And right on the top of it, you know, key points, or I like to say aha moments. Aha, A-H-hyphen-H-A, aha moments. And during this webinar, if there's something that you think, wow, that's something I need to know, that's something I need to put in place for my nonprofit, could you write it down? Because there's so much paperwork that you're getting handed. I recognize that really that one piece of paper might be the one piece that survives the test of time. Let me give you an aha moment for me. If somebody can do your job, a task, somebody can do a task 80% as well as you, give it away. As a leader, learn to give away tasks that someone else can do 80% as well as you. Do you see what I mean? Many times of us leaders, we don't trust other people to get the job done because really only we could do it as well. Well, I like that idea. You know, if somebody else can do that job 80% or more, as good as you, then let's hand it off. Now, it's tough in nonprofit circles because sometimes we don't have the staff. Well, could we get volunteers to do that? I love that new term for volunteers, external talent. External talent. Could we find people with specific skill to do a specific job, maybe it's just an hour or two a week, that they have that great skill and they would love to be able to do it. Okay. Number two there, your body is the last place for stress to show up. If it is showing up in your body, take it seriously. That's cardiovascular and gastrointestinal primarily. So that's your heart and your stomach. You know, people get ulcers when they're stressed out. But you know, if you're feeling pain in your stomach, feeling pain in your chest, please go to a doctor. If it's that point where it's showing up in your body, it's gone past a lot of areas before you start to feel it in your body. I worked with my dad, who was a physician for many years. We did 13,000 house calls together and did a lot of the admin with his clinic, and you learn a lot of things. But here's some ideas from Dr. Swenson, who wrote that book, Margin, with a clarion call for leaders. You know, if you're serving an immigrant serving agency or any sort of nonprofit or charity, no matter what you're doing as a leader, find ways to lessen the stress in your day. One of the things is finding out ways to make sure you're laughing during the day and that you are getting out, seeing nature and that sort of thing. It sounds corny, but those are very things that Dr. Swenson, in doing the many, many studies, looking to research, the double-blind studies and so on, you really do find that these things do work. So here's a couple other things. Check new voicemails and emails maybe only twice a day. So maybe you have 2 periods in a day that you check voicemails and emails. Otherwise you become, connected to your computer. Definitely turn off the sound when you get a new email. Great idea. Number 2, again, this is for from a medical doctor. Wake up, arrive at work, eat lunch, leave work, go to sleep, roughly the same time every day. Now this is from an oncologist. If you saw the McLean's article a few weeks ago, this would be now in late January, early February of 2012. McLean's had on the cover 5 things you don't know that are killing you. And it's from an oncologist who was Steve Jobs' oncologist, kept him living way past anybody thought he could. And he wrote a book called The End of Illness. And I know ABC News shut down their regular programming for a week. I mean, this is a phenomenal, interesting book. One of the keys, he said, is that our body craves consistency. Our body wants to wake up and go to sleep at the same time. It wants to eat at the same time. And it's less about how many hours you sleep and that you do it on a regular basis. So that's really critical. Go to your doctor for annual physicals and tests. How many nonprofit leaders I meet, and we're dealing with an employment issue or a volunteer management issue, or we're dealing with creating a waiver or trying to figure out ways to make the organization more productive and financially secure. And then I find out that the executive director hasn't even had an annual physical in 10 years. Well, let me tell you, I'm at 45 now. I had my first annual physical last year, and I attempt now to book at one. It's hard always to find doctors. In small communities, it's tough. But book them way in advance. Get into the doctor. Get those tests done yearly. Don't be in a position, please, where you're like my dad, where he died, of a surprise colon cancer, a doctor who never saw a doctor. And again, colon cancer, number 2 highest killer for women cancers, number 1 for men. It's so simple to make sure that you're on top of that. And men over 40, women over 40, just ask your doctor about that. I've had 4 colonoscopies. They're not the worst thing in the world. So you probably didn't expect to come on here and hear that, but just hear from me, as someone who deeply loves and cares for nonprofit leaders. Please take the time to take your body seriously. And number 5 there, take pain seriously. One of the things that oncologist said in the McLean's article was to, as a lady, to be careful about high heel shoes if they're causing you pain and aching, and that causes inflammation, which can lead to much worse things. So take a look at it. Anyways, you can Google McLean's End of Illness, and you can find those 5 things that are killing us that we don't think about. But those are some key points there. So that's key staff loss. It's a real critical risk piece for nonprofits across the country, especially more so the smaller that you get as an organization. So let me start with some 7 deadly sins of risk management for nonprofits and 7 virtues. This comes from nonprofitrisk.org, Melanie Herman, so I just want to give her credit for these 2 slides. I think it's very helpful. Number 1, stepping over the banana peel. That's a deadly sin. What it means is, as a nonprofit leader, you know there's something wrong. You see something, you see a staff member, a volunteer, a client, you see something that's, just makes you really think something's going on. But you don't actually do anything about it. You just step over it, just pass it. What we want to teach our staff and volunteers is a great thing you can do actually in a staff meeting or volunteer meeting, staff and volunteer meeting. Actually just drop a banana peel, and you can tell them that in North America, the studies that have been done, that only 10% of people will, in an office setting, will actually lean down, pick it up and throw it out. Most people will not pick up the banana peel. They'll walk past it and just say, look, same thing here at our organization. If you see something that's out of place, and we're not talking about picking up clutter. That's not what we're talking about, although that might be something. It's lights that are out in the parking lot that makes people nervous when they go to the car after working, or it's an angry client, or it's something where you saw fraud or theft, or you're worried that somebody could get injured because of a situation that you saw, or you don't believe that your vulnerable clients are being protected in such situations. Please don't step over the banana. Let us know, please. We want to be a place that's very careful. Let me point out here too, for your aha moments. complaints are a wonderful thing. They really help you become a healthy organization. So, in some organizations, big for-profits like a Walmart, they'll tell you that every complaint has a dollar value. In other words, complaints are worth money. In the nonprofit sector, we need to have that too. We have that mentality. There are always going to be some people, by their very nature, that are going to complain because they're complainers. I'm not talking about people like that. But even in those situations, there might be 10% truth in there that you can find. What we ought to have as nonprofit leaders is a thicker skin, so people can say, I don't think this is a good idea. I don't think this program's working. I've got a concern. I have a complaint, whether it's from clients, from staff, from volunteers, from a funder, is to take it seriously and thank them for the complaint, because you want to become a better, more healthy organization. Number two, don't assume others have your nonprofit's interest at heart. So even if it's another nonprofit or any other organization you're working with, especially other nonprofits, organizations are busy. They don't have time to kind of be focused on your issues, and sometimes they'll overlook something that could cause a reputational problem for you. So just assume that they're busy and that they don't have your interest at heart, that you have to kind of protect yourself. It's one of the reasons I say for insurance, by the way, which is my background. Up until 5 years ago, I worked in the insurance industry and trained brokers for two of the largest insurance companies out of the two of the top three out of the 220 insurance companies in Canada. So I've trained for 15 years, and one of the things that I know is insurance companies too. I mean, they're doing their best, but they don't primarily have your interest at heart. Primarily, they're trying to make money. So you have to think about, what are the things I want to make sure to tell my insurance company each year, and questions to ask to make sure I've got good coverage, a good price. And that's one thing we're going to put up on our website, our resource website, and so you can see that over the next few weeks. Eight questions to ask your insurance broker each renewal. Okay, and that's the next point. Operating as insurance will take care of risk. I'll show you a slide in a few minutes where you can see insurance is great, but it really is not anything close to a full risk management package. Number four, signing a contract you haven't read. I'll mention later the 3 ways you can lose a lawsuit, but one of them is breaching a contract or not fulfilling a contract. Well, a lot of organizations, nonprofits, when they lease a building, they lease a building and didn't realize in the lease it says that you're responsible for the maintenance of the boiler. And if you're like me, you're going, I don't even know what a boiler looks like. So, it's very important when you're signing any significant contract, have somebody read it who knows contracts. So also in that piece, make sure you know who has signing authority, who can sign what in your organization. I know in the organization that I've worked the last 5 years, I can sign up to, agree to or sign for on behalf of the organization up to $5,000. Beyond that, I can't. So that's a great thing to do. For directors, for managers, for supervisors, what do they have authority to sign for? Who can sign for paper? You're thinking, well, my goodness, there's printing companies just dropping off boxes of paper. Well, sometimes they drop off boxes of paper and have you sign an additional piece of paper, which could be an extension to a lease for a photocopier. I mean, there's stories out there that are unbelievable. So if summer students are not allowed to sign for anything, and I don't think they should be unless there's a very specific thing, let them know. Let people know who can contract on your behalf, who can use your letterhead and send out letters and emails with your letterhead on them. Those are a very important piece. Number 5, acting as if screen staff and volunteers will do no harm. We're going to have a webinar here on how to screen staff and volunteers. But even beyond that, we want to keep our nose around, making sure that we're carefully monitoring people. When it comes to risk management with nonprofits, this may be an aha moment. I hope some of you consider writing this down on your summary sheet. When it comes to nonprofits, often the biggest risks don't happen, negative occurrences don't happen with bad people like predators, etc. Most of the problems that happen because of good people with huge hearts who go beyond the boundaries of their job, and in doing that get the organization in trouble. So, that's oftentimes we're not just looking for bad things, we're looking for wonderful people to clearly know what things we don't want them doing. Let me give you an example. In working with immigrants, let's say that's a new immigrant and you're helping them and someone's ill and they ask you to, could you please go get some money out of my bank account? Here's my bank card, here's my PIN number. Well, we don't do that. It's difficult because in a big-hearted volunteer or staff member, we're like, wow, there's no one else to help them, and they know the dilemma they're in. But what a dilemma it is for our staff member or volunteer to have someone's PIN number and bank card. I mean, things can go really crazy there. That very thing happens in hospices, and so we've had to create a policy where no discussions are dealing with finances, just because big-hearted, wonderful volunteers and staff members go beyond their job and can get the organization and themselves into some trouble. Number 6, deadly sin, worrying without taking action. It's so important that when there is a problem that you take action. And one other piece around this, when you fire someone or someone leaves on their own accord, you want to find out, if they're leaving. You want to, and actually firing somebody, you probably wouldn't be able to do this, but when they're leaving on their own accord, have an exit interview. Same with volunteers leaving. Have an exit interview for those who leave on their own, and ask them, what did you see? Was there any banana peels that we missed? Was there any programs you didn't think were working, or things that you thought we ought to be doing? Find out these things. I want to find out staff before they leave, and volunteers before they leave, but definitely when they leave. Find out why they're leaving. Oftentimes we think it's because of something, and it turns out to be something entirely different. Very valuable information, very valuable information. And then number 7, a deadly sin, not getting started. So today I'll talk about lots of ideas. I don't like the term best practice anymore. I like the term best choices, because depending on your revenue, the number of staff you have, and how long you've been into becoming an organization, how long the executive director's been there, etc., the other leaders, everybody's at a different place. So please look at this and think, what choices could we actually put into place? But please don't just not do anything, because there's so many things to do. So here's 7 virtues. That was 7 deadly sins. Well, that was 7 virtues. Okay. Number 1, make policies clear, concise, and consistent. And I can add another word there, kind. Clear, concise, consistent, kind. Clear means if I'm in grade 6, I should be able to come and read it. If I'm somebody new to Canada and I'm a volunteer and I have basic English skills, I should be able to understand the policy. Do not write the policy for university level graduate students. I mean, these policies need to be written for people that everybody can understand them. So important. And less formal as much as readable. You want to make them really readable. Concise means I suggest that you never have a policy more than 1 page long in regular font, not little tiny 4-point font, but make it concise. Consistent means you apply your policies consistently. That you don't give special treatment because somebody's a friend. Everybody gets hired the same. We have a process. There's a process to be fired. There's a process to for all the key things we do, there's a process, and we consistently apply them. And if you want to add a fourth point there, clear, concise, consistent, and kind. I think policies we write should be kind. Often paperwork that I write, policies I write, I start off by saying, thank you for being our staff and volunteers. We couldn't do what we do without you. Number 2, a virtue is ask or invite the tough questions. So critical. Invite the tough questions. Don't be afraid for people to say, you know what, I don't agree with this. I don't agree with the policy. Many of us nonprofit leaders, including me, need to get thicker skin. We have way too thin skin. We take things way too personally because maybe it was our program that we helped develop 5 years ago, 10 years ago. Well, things change. People change. Programs need to change to keep up as well. Number 3, try the simple approach first. When it comes to managing risk, what can we do for free? What can we do that would be simple? Number 4, it's all about putting people first. It's not about lawsuits. I don't train risk management and look at it from lawsuits. Canada is a very safe place to be a nonprofit if you have the basic things in place. I'll tell you when we get to our governance session, there's 4 things. If anybody wanted me to be on their board, wanted me to join their board, 4 things I'd absolutely have to have in place. There's some basic things that you have to do that are practical. There's some tools I'll be sharing with you in these 5 webinars. But the bottom line is it's about putting people first. It's about people protection, not about legal protection. If you protect people, you will protect yourself legally, and you will protect your reputation as well. Learn from experience. Another little aha moment I hope some of you take is please start incident reports. If you don't have incident reports, please start them. So I'm going to give you something to do every couple of years in this webinar. One of the things you're going to have to look at is what bad stuff has happened over the last 2 years. So somebody needs to start incident reports. It's the bad things that happen. It's the almost bad things that happen. It's the car accident. It's the person, the volunteer who fell asleep that almost had a bad accident. It's everything that was a negative experience that you want to learn from as we go forward. Number 6, anticipate the future. Well, the biggest way to anticipate the future is to look backwards. And it's a way of talking to your staff and your volunteers as well. Number 7, seek help. Please seek help. If there's a problem, ask for help. With this program here, I know that they're making me available, OCASI is making me available to help organizations one-on-one. Please use this service because it's a great opportunity for you to have somebody looking in your organization who's had a chance to do that with thousands of organizations across Canada. And I would love to help. And I can tell you my mentality will not be coming in there as an arrogant consultant trying to tell you how to do things, but more so to find out what's working and what's not working, and maybe to point out a few things that might have been overlooked. So here's our 5 webinars. They're all from 10:30 in the morning till noon. They're also recorded. If you're listening to this is a recording of the first webinar, Introduction to Risk Management. February 29th is the date today, 2012, and the webinars will all go from 10:30 to noon. The first hour, which I'm in right now, will be the actual speaking time, and then the second half hour approximately will the Q&A time for the questions that come in. Screening on March 21st, risk proofing after they join March 28th, managing financial risk with Eric Plato, who's the controller for YMCA, the Greater Toronto area. He's worked with the large organizations, small organizations. He's a brilliant guy, very, very easy to listen to and understand from. Amazing guy. He'll be on April 4th. I'll be hosting all of these, but that's the only one where I won't be the key speaker. Number 5, governance. I love this session. I'll tell you how I can tell you in a board agenda in a few seconds whether or not I think the board agenda is any good, but also how to create an engaged, effective nonprofit board, rules of engagement at the board level, how to decide what you need next, what types of people you need next. I'll give you a great board matrix, a board evaluation from Dalhousie Nonprofit Unit. There's all kinds of great stuff, what a great board looks like, and maybe even tell you a little bit about what boards from hell look like so you can help to get away from that as well. And also your 3 legal duties as a board as well. So I hope you join these. Today is Introduction to Risk Management. Well, I'd like to start off by saying risk is normal. It's even necessary, but I don't like sleepless nights. So I tell nonprofit leaders all the time, have a pad of paper next to your bed so you can write down things that are keeping you up worried at night. The dullest pencil remembers more than the sharpest mind, and you can get out of your head and get back to sleep. Today I want to teach you a clear process to find risk, prioritize it, involve your people, and create a usable plan that works. We sent ahead of time 2 documents, 2 PDFs that I'd like you to flip to now. The one is Introduction to Risk Management for Nonprofits. The other one was called Risk Management, the Process. So if you weren't sent them, you can find them with this recording, these PDFs. So it's a PDF of the PowerPoint, a PDF Introduction to Risk Management, and a PDF Risk Management, the Process. So I'll come back to that in a moment if you can just take a look to find that. So what do I think the greatest risk is for nonprofits across Canada and in Ontario specifically? I think after meeting thousands of nonprofits, I think the greatest risk is nonprofits that stop taking important risks because of unfounded fear. So there's a lot of really tough risks out there, and you're working with new immigrants. There's a lot of very vulnerable people in very difficult situations, and you've got all kinds of barriers that could be possible there. There's all kinds of risks that you could think, wow, I don't think we should do that. If you had a group of lawyers all get together, they'd say, hey, stop doing that, that's too risky. Well, I come at it from a different standpoint. I've looked at the lawsuits, and I have a pretty good concept of what's happened over the last 10 years. I think nonprofits can take really impactful risks that really help people. They just have to be smart about it. And I think one of the things to first off agree is the fear we're feeling as a group, as a board, as a senior leadership team, as a group of supervisors, is it toxic fear or adaptive fear? Toxic fear is fear based on fake evidence that looks real. Like sending out a risk management survey to a bunch of seniors buildings, and this is a true story, over 100 seniors buildings. There were low-rise buildings where seniors lived by themselves primarily. There's no nurses or doctors there, they just lived on their own. And the Risk Management Committee sent out a survey saying, what are you worried about? Which is a great starting way to start the conversation. However, they based their what they started doing for risk management on this evaluation. Well, the seniors said, well, we're worried about this, that, and the other thing. But the number one thing was they were worried about being mugged, being attacked in the building. So the Risk Management Committee, without finding out if this was really happening, went and spent over $1 million across these different buildings, put in place a pass card system. So you'd come up to the door, you'd have to have the plastic card, beep, you can get in the door. Please don't open the door for anyone who doesn't have a card. You know, that training happened. Now, a year later they came back and asked, how's it working? Well, they were finding these plastic cards in the trees and shrubs because the seniors weren't too worried about this, because many of them, rather than coming down 3 floors to open the door for their grandson Billy, they would throw the card out the window to the grandson or whoever was visiting. And they were finding these plastic entry cards in trees and shrubs all over the place. Quite amazing. Now, when they actually now did what they should have done at the beginning, they sent out a survey saying, what of the following risks has happened in the last year? In other words, not just what you're worried about, but what actually has happened over the last year, 2 years, 3 years. You know, it's amazing. Over the previous year, in all of these buildings, not a single senior had been mugged. Now, what's interesting now, going forward, I know 2 people are on that board, one of them a lawyer, on the Risk Management Committee. Now, all of those plastic code systems have been all ripped out. People hated them. They were a real hassle, and they had a lot of negative impacts as well. Bottom line is, it was the bad risk management solution because it was based on toxic fear, fake evidence appearing real. Adaptive fear is what you want to have. It looks at things realistically. It pushes fear through a process, and I want to show you today what I think you can do. So let me just jump from there. Do you mind jumping to your PDF? And it's Risk Management the Process. And the document, the PDF called Risk Management the Process. I'm going to stay on the same PowerPoint screen, but if you could just jump in to the PDF we sent you called Risk Management the Process. On the front it has a, Risk Management, Introduction to Risk Management. On the front it's in red, Introduction to Risk Management, and it has a quote, all life is the management of risk, not its elimination. I like that quote. If you open it up, you can see there on page 1 the greatest risk, which I've already gone through. On the bottom there, what is risk? Risk is anything that threatens the ability of a nonprofit to accomplish its mission. It's a very, very helpful definition. And one way you can categorize different risk is looking at your organization having 4 assets: people, property, income, and goodwill. I'm on page 1 in the PDF called Introduction to Risk Management for Nonprofits and Charities in Ontario. So those are the 4 categories. Page 2, what is risk management? I put some definitions there. There's toxic worry and adaptive worry. And then it gets into obstacles for risk management. You can take a look at that. And then it goes on over into 14 motivators. And one of the things I just want to point out is that, you know, feel free to copy this for your board. Feel free to copy this for your staff. But it's primarily the board members that really need motivation to get working on this. And I'd give them these and show them the value in taking some time. To me, risk management really is about organizational health. It's healthy management. It's efficient management. But you can see it's going to really help you in the long run. I just want to take you to the last page, page 9. What is your slippery grade? In the page just before this, it gives a lawsuit with Loblaws. And Loblaws are wondering, well, why would we talk about a lawsuit for Loblaws? A grocery store, Zehrs in Barrie, Ontario. On page 8, an 80-year-old customer, in the second paragraph, she slips on a grape in a Zehrs store. And you're wondering, why would I mention this? We're nonprofits. This is not something relevant to us. Well, let me just point out, I have identical twin 6-year-old boys, Jack and Jonah. And here's something for your aha moments you might just jot down. Did you know that in Canada, nonprofits and charities face the same laws, have the same laws as for-profits do? In other words, if something bad happens at your nonprofit, and that very same thing happens at McDonald's or Home Depot or Swiss Chalet or Canadian Tire, you go before the courts with the same laws. There's no immunity in Canada for charities and nonprofits. There's really no laws protecting even the volunteers, except if you go to Nova Scotia, where they have the Volunteer Protection Act, which protects the nonprofit volunteers, not the organization, but the volunteers from certain liabilities. But in Ontario, we have nothing. So when something happens in the for-profit world, it's immediately applicable to the nonprofit world as well. So an 80-year-old lady comes to the Zehrs grocery store owned by Loblaws in Barrie, Ontario, breaks her ankle in 3 places, right? She slipped in the area where the grape display was. You know when you go to get grapes, if you're like me, you want to taste a couple of them because you don't want to pay $10 for a big bag of grapes and then have your kids not eat them. So you might eat one, see if they're sweet, or you might reach to the back to get some that haven't been pawed over by 300 people. And in doing so, grapes fall on the ground. At Zehrs and in Loblaws, they determined that slippery grapes are the greatest risk they face out of hundreds of risks. When they do a risk map, that's the critical risk. And they have somebody watching every 45 minutes, going and checking the area to see, is the carpet they put in front of the grape display, is it turning into wine? Is it doing good? They can pick up the loose grapes. They can change the carpet. In this particular case, even though they had a great policy, someone was watching, every 45 minutes somebody comes and checks it. In this case, a young kid who was working, and by the way, I heard the story first person from someone who worked there when I was doing a training in Belleville a couple of years ago for nonprofits, and she actually worked at this very Zehrs store. But if you speak enough times, you'll eventually run into people that are in most stories. But she was there, and she told me how this worked. They really took this seriously, but this one staff member who was new, relatively new, on one day messed up. And instead of changing the carpet, immediately replacing with a new one, with pylons around it, etc., he took out the old carpet and left the area, the grape area, with no carpet. And this poor 80-year-old lady customer slipped and fell. Now, you kind of wish that she went, kind of hoping she wins, but actually no. In terms of risk management, you want her to lose, and she does lose. Then it goes back to the Court of Appeal, and they rule again in favor of Loblaws. See the middle paragraph on page 8. Upholding the original ruling, it gave 3 reasons for decision. Number 1, evidence that Zehrs had a detailed floor maintenance program. In other words, they had risk management in place for their critical risk. Number 2, there was evidence that their employees regularly checked the floors, removed fallen items. In other words, they have a policy, but people actually do it. Number 3, there was no evidence that accidents from falling grapes were a reoccurring issue at the store, or that employees took their maintenance inspections duties casually. Here's the amazing thing. If you go back to page 7, number 14, risk management is phenomenal. Not only can it be a valid defense in a lawsuit, number 13, but number 14, it may be a valid defense in a lawsuit even if your volunteer employee did not follow your policy. So in this case here, we have a staff member who doesn't follow the policy, and you're expecting, oh my goodness, Loblaws is going to lose for sure. Well, no, they don't lose, because look at the second and last paragraph on page 8. The standard of care that most jurors expect, or the courts expect, and might I say you could write stakeholders too, because that's the people in your community, that's your funders, etc. The standard of care that most jurors expect when they apply their common sense is far from perfection, wrote the lawyer Todd McCarthy. What is important is to show the jury, or I might suggest to your stakeholders, a system, if not a perfect system, a system that's carried out and that demonstrates, please circle these words, reasonable care. Reasonable care. Perhaps not perfect care, but reasonable care. Here's the point. Whenever you're dealing with risks that you face as a nonprofit, what you're not after is perfection. We're after reasonable care. It's a reality that you cannot possibly figure out all the risks that you could face or all the problems that could happen. So on the last page, page 9, I just ask you a question as a nonprofit leader. What's your slippery grape? Or as a leader over a team, or as a leader over a particular program, or as executive director, what's your slippery grape for your organization? Looking at 2 factors, frequency and severity. Something that's bad that could really has a good chance of happening, and severity, if it was to happen, it would have severe consequences, right? So think about that for a moment. What would be your slippery grapes? Well, let me tell you, I have a process I want to take you through on how to find that out. Okay, back to the PowerPoint here. I'm going to put that first document down, and in a moment will be the second document, risk management process. Okay, so back to the PowerPoint, risk management versus insurance. I just want to point out, I mentioned earlier that insurance is not the be-all and end-all when it comes to risk management. Your organization as a nonprofit has 4 main assets: reputation, people, building and contents, money and revenue. And look here, insurance, although I really believe in it, and that's my background, I no longer sell insurance anymore. I work for charities and nonprofits. And let me tell you, it doesn't cover your 2 greatest assets, reputation and people. It's needed because we need it there for our other assets and to make sure that we're well protected in areas that insurance can cover. But risk management together with insurance fully covers everything. Risk management really does protect your reputation. It really does protect people from being harmed well before they get harmed. So we need to do insurance, but I love, my favorite line when it comes to insurance is get great insurance at a great price. And by the way, on that end, we will be putting a document up that I wrote called 8 Questions to Ask Your Insurance Broker every year. And number 2, do consider asking for 3 written insurance quotes from your broker every 2 years. Every 2 years, ask for 3 written insurance quotes because you do need to see if you're paying a good price for the coverage that you have. Okay, number 3 here. Risk management requires lots of average people. One definition for risk management is organized common sense. I love that. There are situations where you do need to call an expert. For instance, you're firing somebody. My suggestion until you become experts at the law in terms of terminations, get an employment lawyer, not a regular lawyer, an employment lawyer who is used to terminations in a nonprofit setting. There are situations where you need an expert like that. That's great. But most cases, we just need average people, lots of average people. So this book, The Wisdom of Crowds, is an excellent book written by columnist James Sherwicki. He looked at this idea that the crowds actually have more wisdom than individual experts. So look at this here in the bold. Large groups of people are smarter than an elite few, no matter how brilliant, better at solving problems, fostering innovation, coming to wise decisions, even predicting the future. One of the things he does is he spends some time looking at many different studies, but one of the studies they looked at was, remember Regis Philbin, Who Wants to Be a Millionaire? He had, there's a game show on TV, and they had questions would come up, and you had 4 choices, A, B, C, or D. And if you guessed the right one, you could move on to the next dollar value question. But one of the things he looked at in this book was the lifelines. Remember the 3 lifelines that you had for Who Wants to Be a Millionaire? You had 50-50, where the computer would take away 2 of the wrong answers. You had call a friend, which is like calling an expert because you'd have people lined up in all different topic areas for a question you might have in history or movies or geography. You'd have them lined up. So there was 50-50, there was call a friend, and there was ask the audience. Now, one of the things he looked at here was all of the different Who Wants to Be Millionaires across the world. As many countries have their own version. The United States had theirs, Canada had their own. My wife's from a little country called Estonia, just south of Finland, and they had their own. They looked at all of these, and they averaged out for the difficulty of question, and they looked at it. Which of these 3 did people, of these lifelines, did people hold on to the very end? Well, you know what's very interesting is that in North America especially, we kept call a friend to the very end. In other words, call a friend was the most valuable of the lifelines. But yet when you looked at the results from what actually did happen, the most valuable one, the one that actually did give you the best answer by a significant margin, is ask the audience. Regular people in the audience, but there's a crowd of them, right? There's probably 100 to 200 people in those crowds. When you get the wisdom of crowds, it gave better answers than the experts. Isn't that phenomenal? And yet in our North American culture, we are very much twisted in this thinking that we don't ask difficult questions of large groups of people. We bring in experts. Now, sometimes you need to. Sometimes you need an outsider's point of view. However, many times you need to be asking your own people. Do you know that's what consultants usually do anyways? When I go and work for an organization, as I do now full-time, is I often am interviewing the people. I always interview people that are close to the action, close to the problem area, and try to see what the problem is, but also what they think the solution is. Many, many times we find out, simply by working with your own people. And sometimes you need an outsider who can talk to your own people, but even better, it's be able to talk to your people yourself. Okay. Leaders need to lead. We mentioned this earlier. It's just all about creating this environment where people feel they can ask hard questions. They can say when they don't think something's working. They can admit mistakes. A great trait of a wonderful leader is that they admit mistakes themselves. Now, you can't do it too often, but if you admit mistakes, it allows other people to be able to admit mistakes, right? So leaders need to lead. They need to say when they don't get something, when they don't have enough information, when they don't agree. And it doesn't mean you're the top leader. It means you're able to go to the top leader, and the top leader has thick enough skin to be able to say, you know what, I think I made a mistake here. I think you're right. I think this program does need to be fixed. Great quality of leaders is that they listen and they lead. They listen first, they lead second. So we really need that transparency, right, where people can feel that they can be honest, they can have candor. It's a great quality of a good organization. Saul Casimir, who ran the YWCA for many years, and including his time leading Montreal YWCA, I think 25 years leading altogether. And I asked him, what's the key characteristic of a healthy nonprofit? And he said this: culture of candor. That people are allowed to say, I don't agree, but they do it agreeably, right? They do it in a nice way. Nobody likes to be around people that talk in a way that make you feel, stupid. You want to be able to say, look, wow, I appreciate you so much. I understand why this program was put into place. I understand why these different policies were put in place, these different procedures, but I think we can do it better. And here's some ideas. So we want to create a culture where people are free to give new ideas and question things. We don't want a culture of secrecy or it's not my job, right? Or cover your butt, right? And even an open door policy on its own is no good unless people are coming in the door. So you have to ask yourself as leaders, A, do I have an open door policy? And B, are people coming in the door? If they're not coming in the door, something's wrong. They're nervous. There's a reason you have to get to the bottom, right? So I'm not going to spend a lot of time on this, but there's two different ways that you can inspire people. You can inspire them with legal motivations, and that's simply we need to protect ourselves from a lawsuit. And I don't spend a lot of time doing this with organizations, but I do this with boards. You see the target audience there in red? Target audience for this is the board or senior management. I talk about the lack of special legal protection that we have here in Ontario and across Canada, that nonprofits and for-profits are identical twins before the law. I discuss actual lawsuits that organizations like yours have faced, and I explain the key legal concepts. Let me just point out here, if you flip to page 10 of the second document, Risk Management, the Process, I'll point out to you on page 10, so it's Risk Management, the Process, flip to page 10. At the top, you can see 3 ways to lose a lawsuit. It's listed under liability negligence. Only 3 ways that you can lose a lawsuit. Number 1, when a law is broken. You break a law. And let me just point out here as an aha moment, that includes breaking your own bylaws. That's why it's so important to update your bylaws. If you're not meeting a bylaw, then change it. If it's something that just needs to be changed, please change it. Number 2, breaching a contract. I mentioned that earlier. We want to be very careful who is signing contracts on our behalf, and we've got to make sure to pass it through, pass contracts that are complicated, difficult to read, pass them through somebody who can read them. There might be a case where you're going to use a lawyer. You're signing a lease to a new building, signing a photocopier extension. It could be all kinds of things. Just have somebody check. Third is negligence. It's not doing what a reasonable organization would do, in the same situation. So most lawsuits fall under negligence, and the only way you can really know what areas to protect yourself from negligence is do a risk map, which I want to talk to you about doing right now. Please do take a chance to read vicarious liability there at the bottom of page 10 as well. So we'll put away that document there. Well, and I'm trying to get a lot of stuff covered in 1 hour, but you're getting all the key principles here. So the key word, back to the PowerPoint here, is reasonable when it comes to the law. Not perfect, but it's reasonable. And the second word I like to tell people is active. It's one thing to have reasonable risk management. You also got to make sure that your staff and volunteers know about it, right? For your key risk. I'm talking about especially the 3 or 4 or 5 things that really could get you in trouble that staff know, volunteers know. When we have a special event, only certain people speak on our behalf to the media. There's an example of a risk for a special event. We know that there's a media person that handles that. Or if you're a small nonprofit, you don't have a media person, which most of the ones I deal with do not. Well, who is it? Who are we going to assign to talk to the media if any media shows up for an event that we're doing? So other than getting people motivated through lawsuits, which I would do with the board, with staff and volunteers, I like this option much better. Ask your people in A there what effects your nonprofit work has on clients and on them. So basically you're asking volunteers and staff, why do you come to work here? Aside from just the pay, which is an important part, what is it about coming to work and doing the work with immigrants that we do that really helps you wake up in the morning, right? I'd also like to know what things cause them issues, but that's not today. This issue, I'm trying to figure out what are we doing right? How are we helping people? And they'll start telling you, wow, here's a story about Fernando, who came from such and such country with his wife and kids, and he had no idea, you know, how to settle in, and we were able to help them in this way, and this way, and this way, and you start hearing the stories from your staff and volunteers, and it really stirs. It starts off very quiet. Before you know it, people actually jump in. They go, wait a second, let me tell you a story, and they tell you all these things. Well, B, I would then explain and say, great. I mean, this is amazing to me. The hair standing on my arms, all the wonderful things you're able to do. All of these things are priorities for us. That's why we're in existence as a nonprofit. But I'm telling you, starting today, we have a new #1 priority ahead of all these, and that is we want to protect you. I don't like the term risk management, really, as I mentioned before. I like this to be thinking about protecting people. And authentically done and communicated to your volunteers and staff, you can now ask them for help doing your risk management. Well, what kind of help do we need? Well, here's what I'm suggesting you do. This is the core of the getting to the end of the webinar here. What could you do every 2 years? Well, I'm going to suggest, I'm going to go forward here, every 2 years creating this colored risk map. You can find others if you Google risk map. There's other variations, snakes and ladders one, and so on. This one I like the best because it's nice and colorful. What I want to do is I want to every 2 years figure out what red critical risks we have, and maybe the high risks in orange too. And that means that risks that are almost certain or likely to happen, and they would have major, extreme, even moderate impact. You see that? So I'm working with a youth serving organization. Obviously, I'm very concerned about molestation. I'm working with seniors. I'm very concerned about slip and fall. If I'm working with different groups of people, it depends what type of people you're working with and what type of staffing and volunteers you have and the funding that you have. Where are your areas of concern? Well, you're probably thinking, I'm not really sure. Well, what I'd like you to do is be able to figure out what that is every couple of years. But how do you do that? Well, let me tell you right now how you do that in this next few minutes we have together. Okay. Create a laundry list. But how are we going to do that? Well, we're going to put together a task force. Not a committee, but a group of people, maybe maximum 12 people, minimum 3 or 4 people, depending on the size of your organization. You know, with OCASA, you're getting to know other leaders. Possibly you can work with other immigrant serving agencies and work together on this. But every couple of years, put together a diverse group of people, diverse in terms of skills, experience, personality. I want to have somebody on this task force, though, who's trying to figure out what our risks are. At least one person who, you know, wakes up on a sunny, beautiful day and says, I think I see clouds coming. You know, it's a person who is kind of the worrywart, but they're wonderful to have on this task force. Maybe only have 1 or 2, or else you never get anything done. But I want somebody who, you know, if you're going to take people swimming, canoeing, that they're going to think about how deep is the water, is there any rocks down there, how many life jackets, how many trained lifeguards do we have. It's the people that are really good at details and seeing problems. I want to have at least one of those people on this task force. I'm going to put them together for 90 days, roughly. You can do less or more, but roughly 3 months, and we're going to meet every 2 weeks for, let's say, 2 or 3 hours. That's my task force. I'm not creating a committee that's never going to end. You don't know what we're doing. I'm creating a task force who's going to create that colored risk map, okay? So what do? They start off by just, there's no wrong answers. We want to start looking for risks. Go through A, B, C, D, E, and F here as a risk team, as a task force, and do the things I've listed here. And you want to dig. You want to not only find out risks, but you want to dig deep to say, what are we talking about here? If it's a financial risk, what specifically are the financial risks? Don't just say finance, but really dig down into the details. Really dig down into core issues. If there's a building with some stairs that are slippery, what building, what stairs? You're probably going to have 40 or 50 things after you do this. You meet for hours. And look at F there. Then take your list and show it to a larger group of staff and volunteers and say, hey, we're missing anything. So you get this idea. We've got a large, long list of risks. And then here's some areas to consider to make sure you've covered off everything. I put some, listed some key phrases that might be helpful to you as you're doing this. But how do you then put them up on this risk map? Well, I love the answer to this. The answer is garage sale stickers. Go to Staples or Walmart. Staples is where I get them from. And ask for garage sale stickers. There's a $3 sticker, $2 sticker, $1 sticker, 75-cent, 50-cent. And what you want to do is as a task force is now getting close to mapping them up and deciding what's a priority, each of us go around and describe, okay, of these, say, 40, 50 risks we come up with, I'm going to give my $3 sticker to that risk. It's the risk that you believe needs to be handled first. It's the most critical one, given everything you talked about as a team to that point. And everybody in the risk group votes. I'd like to have a board member, one board member on that task force too, if you can get one. And then you present it to the board. That's your job at the end of this 3-month period. Every 2 years, you're creating this risk map, bring it to the board saying, look, here's what we think are the top risks. And you can just simply add up the one that has the most money. It's $3 stickers, $2 stickers. The risk that has the most money, that's number 1. Number 2, number 3. Give it to the board. They can ask you any questions they want. And now it's up to the board to decide what they're going to do. They don't have to do things based upon the risk team. The board is legally liable for the organization. But they need to look at it and say, okay, so we got working on, let's say there's 4 or 5 things you're working on. You can map them out over the next couple of years, saying exactly when you're going to get to them. If you've got the resources to get to them right away, get onto them right away. You disband your task force that put together a risk map, say thank you so much, they're done, and then you start a new task force to work on a particular risk that needs to get worked on. So map it out over the next couple of years, exactly when you get to things. You're going to guesstimate when you're going to handle different risks. Now, some organizations where I work with have no staff. And so it can take them a long time to get things done. But with critical risks, you cannot mess around. You have to reasonably deal with risk. If it's something that an average person would say, my goodness, that's something you need to get working on, you really have to think in terms of being reasonable. Map it out. Every risk that you get, now we got to deal with them. Here's a filter list to put it through. Number 1, make sure you always ask this question. Before we keep this risk, does it pass our mission? So Big Brothers Big Sisters, who I work with quite a bit, they match vulnerable little boys up with men. That's a crazy risk, but does it pass their mission? Absolutely it does. So make sure it passes the mission test. I know one immigrant organization that I met in the host program in Ottawa. They were helping new immigrants to learn how to skate, and then some that had a league to play hockey at. Now I think that's amazing, but you got sharp skates and sticks and ice and hard ice and cold and frostbite and all the risks. Does it meet our mission? Probably yes, but you've got to ask yourself that. And this one organization, they said, yes, it meets our mission. But then we've got to ask, do we have policies and procedures in place, helmets and proper training, and you know what I mean? We just got to be careful. Neck pads so that no one gets cut across the neck during the skate, that sort of thing. And then once you've got that in place, think, okay, if a bad event was to happen, would our stakeholders, our funders, our clients, our staff, would they say, yeah, you know what, it's a shame this bad thing happened, but I think that they passed their mission test and I can see how their policies and procedures were reasonable. And then finally, think about insurance. If you're doing an event involving alcohol, you should know that alcohol is excluded on almost every liability policy. So you're doing a special event of alcohol involved, make sure you got insurance. Doing a special event raising funds and there's golf carts, well, you probably don't know your liability policies exclude motorized vehicles. So again, talk to your broker. Anytime you do something new, talk to your broker and do it by email so you have it in writing. So there's some other ideas I've put down here, but I just want to end in summary because I realize that our hours come to an end. In summary, protecting our people must be priority 1. It's not about risk management, quote unquote, right? Risk management doesn't really mean that much, especially to volunteers and staff. It's really about creating something where our people are safe. You will keep your best staff, your best volunteers for longer, statistically proven, if you have risk management in place. People want to feel safe. And it's not just they physically feel safe, but they want to know that their programs are done well, that the people they're working with are safe too. Number 2, don't create policy without involving the volunteers or employees who currently do the work. Please make that an aha moment. Policy writing should be done by the people who do the work. I mean, they should write it using their words. Board members should not ever write operational risk management unless they are actually doing the work. So if you have volunteer drivers and you want to create a volunteer driving policy, have volunteer drivers create the policy, and you may need some help with the writing of it, but listen, I would like it to be in a way they understand. Ask them what they see the issues are. Ask them what they think should be done as policies. And I mean, that's not the end of the work. You're going to have to occasionally ask others for their opinion, but I'd like people who are getting a policy handed to them to look at it and go, hey, I wrote this. I had a part in writing this in this. For your key risks, number 3, put it in writing. Number 4, I talked about it earlier about making it simple, concise, kind. Number 5, that's the kind piece. If you've done it done properly, risk management policies, they really energize staff because they were involved in it. Document, number 6, document retention, you get my little idea on that. My personal feeling, and working with public health too, is if a volunteer employee role works directly one-on-one with clients, where they're alone with clients, I'd like to keep their volunteer and staff file, not their vacation request, but their staff file, their important documents, forever. Otherwise, I'd keep it for 3 to 5 years after the person's left the organization. Keep your insurance paperwork always, forever. Number 7, most nonprofits I meet have severe, significant areas of risk they want to work on. Let's do start, but start slow. If you're a big organization, you've got some paperwork, focus on slimming it down, right? The big binders, it's, you know, even legally, courts understand. People don't read these things, certainly don't remember them. Number 8, start risk management. Strong risk management requires transparency, dialogue. So help people feel free to say that they've made mistakes. Tell people as a leader the mistakes that you've made. Just open up and allow that you want to be a place where people can bring ideas. And number 9, along the way, celebrate. If I haven't mentioned it yet, here's a great aha moment. Every staff member, volunteer member should have an emergency contact list, because you're going to have to create policies that say, here's a rule. For instance, we don't work with people one-on-one in private settings. So that may be a policy. It may not be possible in your situation. I know in many situations we've made this kind of a rule. So say working with young people, we don't, we're just not one-on-one. We're not going to drive a young person home one-on-one. What happens if the parents or other people don't show up to pick up the young person? What do? We just leave them there because we got a policy? No. But we can phone our emergency contact list and say, I know I've got a policy. I'm not supposed to drive home somebody one-on-one, but we're stuck in a situation. So they get permission from a manager to break the policy. It's written down somewhere, and away you go. That's so critical that emergency contact lists that kept up to date is important. Executive directors, a little emergency contact list for you would be other OCASI and executive directors, people that you can talk to and say, I've got a problem. What do you think? Final slide. The nice thing about doing a risk map, which I just mentioned, and doing this work with risk management, is that you know what your risks are. Your head's not in the sand, like, I don't want to know, I don't want to know. I've had many board members across the country say, I've been told we shouldn't talk about risks, and legally it's better. Well, that's total nonsense. It's the worst thing you could do is not try to figure out your risks. Figure out what they are, and figure out which ones are critical and get working on them, right? So here's my final question. What can you practically do in the next 90 days, given you resources? Could you create an emergency contact list? Could you start thinking about creating a task force? You put them together to create a risk map. I got other ideas on how to determine risky jobs. A great idea called a boundary form for our riskiest roles. Driving quick risk tips. We got all kinds of ideas. Here's my email address, davidandrewhartley@gmail.com. If you are looking for some help with specific risks that you deal with your organization, then I know that part of this funding is to allow to do that too, so that's great. You'll find resources up on the website. I want to thank you for all the great things that you do in helping immigrants across the country. And if you have a question, you can go ahead and email them in, and I'll make a Q&A document up on the website. Thank you so much again for today. All the very best.